Good morning and good afternoon, everyone. My name is Anthony Priori. I'm the Digital Marketing Specialist at TPGi. We're just going to wait 1 minute as people sign in, and we'll get started briefly. While we wait, though, if anyone wants to chime in the chat and share where they're logging in from, it'd be great to see where everyone's watching us. I still see a few people trickling in, so I think we're going to give it just 1 more minute and then we'll get started.
Yeah, it looks like we got a good variety of states for the webinar. People from all over.
And some familiar faces or names.
All right, well, thank you everyone for joining us today for our webinar, Modernize and Improve the Patient Experience with Self-Check-In, with Laura Miller from TPGi, Kiosk Information Systems like Mike Rodenbush, and Catholic Health's Patrick Smith and Balaji Raman. Before we get started, I have a few housekeeping items I'd like to get to. So firstly, this session is being recorded and we will email everyone the recording after the event. Secondly, we have captions available, so feel free to turn those on, use them as needed. Next, we will have time for a live Q&A later in the webinar, so please, if you can, use the Q&A box, and we'll answer as many questions as we can at the end of the presentation. It's easier for us to see them in the Q&A box. If you send them in chat, sometimes they can get lost, although we'll be monitoring both. So if you do have a question, I just recommend putting it in the Q&A box. And then lastly, if anyone needs any accessibility support, training, or usability testing, we will send out an email with a link to schedule time to speak with one of our experts after the webinar. So with that, I'm going to let Laura take over and get started. Thanks, everyone.
Well, welcome, and thanks all for joining as we discuss modernizing and improving the patient experience with self-check-in. This is a little bit different than what our typical accessibility webinars are, where they're very accessibility heavy and sort of focus a little bit less on the broader application of the kiosk experience or the website experience or whatever it is. In this case, we're talking about kiosks and self-check-in. And we have some great company with us today, including Mike Raudenbush, Senior Director of Sales at Kiosk Information Systems. Mike has spent 13 years in the kiosk industry. If that slide is as updated as it should be, it's probably even longer. Mike, aren't you like, 25 years in here now?
Feels longer for sure.
So Mike specializes in working with clients and partners to develop and deploy complex kiosk solutions involving hardware, software, and services as well. He has experience in meeting various hardware requirements, including accessibility within self-service implementations. So Mike is our kiosk manufacturing hardware software expert that we've brought to the table here. And because we work with Kiosk Information Systems pretty heavily on accessibility work, Mike has been run through the ringer on accessibility as well. And then we also have Patrick Smith from Catholic Health. And this is exciting for us as we are bringing the actual case study deployer of the kiosk to the project to the table today. We have Patrick, who is a senior systems analyst for patient access systems. Patrick is sort of the guru on this particular project and has 25 years of healthcare experience, 8.5 years in IT, and he has worked to implement the Epic revenue cycle for 6 facilities within Catholic Health Services. And then in particular, and particularly relevant to this project, he has implemented the Welcome tablets to over 140 departments, and they are currently transitioning from tablets to kiosk, which we'll discuss a little bit. And they've rolled out over 400 kiosks with, over 40 kiosks with plans to roll out as many as 300 into 2024. And during this entire presentation or panel, you'll hear us talk about Epic. Epic is the welcome. We're talking in particular about the welcome application, which is the check-in application that Epic, which is an EMR or EHR for healthcare systems. Basically, the way that all of your records are managed goes through Epic at many healthcare facilities. And so that's what we're talking about today. And Patrick can give a little bit more detail on that. We also have Balaji Raman, Director of Patient Financial Systems at Catholic Health. And he and Patrick both have 25+ years of healthcare experience. I feel like, Mike, I feel like we really needed to pad yours a little. 18+ years of revenue cycle in operations and information technology. Balaji has also led multiple EMR implementations and has a lot of experience sort of throughout the hospital organization. So this is, that's our panel today. Those are the folks we're going to be listening to talk about the Catholic Health kiosk, check-in kiosk deployment. I'm going to turn it over to Mike really quickly to sort of talk a little bit about kiosk and the kiosk portion of this, and then we'll go on to Patrick for the Catholic Health portion. You'll hear us talk a little bit about accessibility throughout. However, we're really trying to discuss this more as a broad implementation and what kiosks bring to healthcare in general, and then remind everyone that all of your kiosk deployments should be accessible and should have accessible features on them. And we can discuss that throughout as well. So Mike, pitching it back to you. Oh, and before I move on, I just want to say shown on the screen is basically there are 6 kiosks in what looks like to be a patient waiting room. The kiosks are all horizontally landscape modeled touchscreens on almost like a pedestal. And there is what appears to be like a Storm audio nav input device on there as well, and maybe a camera up at the top, not quite sure. But it's 6 of them in a waiting room for patient, probably a hospital or office, doctor office.
This is actually one of our CenterReach hubs, and consists of multiple practices
Cool.
and
So Patrick,
doctors.
oh, sorry. I just wanted to let Mike go real quick and then we'll go into what this is. I just didn't want to forget to do the description because I totally would.
Yeah, no worries. Thanks, Laura. I'll go quick. Appreciate you and the TPGi and Vispero teams for having Kiosk on this webinar today. Kiosk is a self-service solutions provider. So we design, manufacture, build, deploy, and support the kiosks that you see here. And I'll let Patrick talk about the implementation on. We're located in Louisville, Colorado, so we're very centrally located here in the United States. We've been in business for 30 years, and we have over 300,000 kiosks deployed around the world. And within those kiosk deployments, we definitely do focus on the accessibility side of the solution to ensure that all different consumers and users of our kiosk, patients in this particular case, have the ability to interact and use these devices when they come into these different environments. So in conjunction with Vispero and TPGi, we've had a very successful implementation of our healthcare kiosks, and definitely appreciate Catholic Health and our partnership that we have in implementing these solutions. So with that, I'll hand it over to Patrick to just kind of talk through the solution and everything that we have done for Catholic Health today.
Yeah, sure. Looking at this picture again, these are our kiosks. We designed them from scratch with Mike's team. The writing, the hardware, everything was designed by Catholic Health and Mike's team. They consist of scanners for insurance cards, driver's license, a barcode scanner for e-check-in. We have Instamed devices on them for payment collection, and ADA nav pad to assist with screen reading. And on the top there, that camera is for facial recognition. Looking at this picture, this is again one of our hubs. Consists of multiple practices. We have an urgent care center at this hub, and the kiosks have really been a success there. Some of the challenges that we've faced throughout the implementation, we did start with welcome tablets, and those tablets really didn't include all the functionality that the kiosks include for us. So we're starting to transition. Some doctors' offices still like to use them for patients that maybe don't complete the full workflow through e-check-in and don't have good scheduling, or might be a new patient. But some of the challenges, again, that we faced during the implementation process for this, we really wanted to transform our workflows into an enhanced digital experience. We also wanted to decrease door times for patient satisfaction. This basically opened our eyes to reducing data entry mistakes and improving the accuracy of patient data as we collect them from patients. Utilizing the kiosks, it gave us an opportunity to increase our point of service collections with the Instamed device, just making sure that, we had all everything we needed to have verified for patients. And when they came in to our, doctor's offices, practices, that we had all the collection information that was needed to make sure we were collecting accurate amounts of money. We needed to, relook at our training to make sure that we educated our staff properly. And, one of the big challenges was really reducing the workload for front-end staff, allowing them to perform other tasks besides just checking in a patient at the desk.
So Mike, can you tell me a little bit about something that you mentioned really early on, or that was actually in your bio, about the conversion, or sorry, not Mike, Patrick, from the conversion to from tablets to kiosks? So originally these were tablets, is that correct?
Yeah, so the welcome program is what we use for Epic, our EMR system. And by implementing the tablets, we weren't able to really incorporate payments into the tablets because they're Wi-Fi, and there's certain regulations out there that don't allow it. The tablets are heavy. When patients were trying to take pictures of their insurance cards, driver's licenses, it's kind of hard to do. Basically putting a driver's license and insurance card on your lap to take a picture of it. And and with the Wi-Fi connections, tablets tend to drop a little bit. The kiosks are hardwired in, which allows a smoother workflow for the patient. Patients aren't dropping like they would if they were utilizing the tablets.
Mike, can you chime in with any of the other advantages of tablets over, or of kiosks over tablets, of why people might switch?
Yeah, specifically in the self-service part of the implementation, tablets are not really designed for a 24/7 usage and power on. They're really kind of more so like a consumer grade device that's being used. And in some scenarios, it does work. But for something like this, I mean, you see the 6 different kiosks with the self-service and the payments and the different functions and features within that device. It makes it much easier for consumers to use it, and for operators in healthcare facilities in this case to be able to ensure its uptime and reliability over a long period of time, not just over 1 year, multiple years.
Great. And Patrick, was there what inspired Catholic to go this route in the first place? Like, what was the impetus for the tablets and the kiosks in the first place?
Well, just to transform our workflow into an enhanced digital experience, and from patients receiving messages to good scheduling, making sure everything's up to date as we move forward in time, and really pull all the products together that we have at our fingertips. And the kiosk just is a much better product than a tablet. So
excellent. And how long did this project take to get started and to implement?
Looking back and getting all the pieces that we needed to get together, probably 6 months to a year, with the designing and what components we needed. And we did shop around and look at other kiosk products to see which company was going to help us with what we needed.
And just in terms of who was this intended to serve, is it intended to serve every single patient that comes in to check in via the kiosk, or are there also people available for check-in help? Is it 90%, or do you know what, maybe not percentage, but just in general, do you know what that looks like when folks enter the facility? How many of them are using a kiosk, versus has this alleviated the number of staff that you need at the desk, or anything like that in terms of wait times and things like that?
Yeah, with regards to trying to accommodate all patients, we did streamline our workflows. We have our staff being trained to gather as much information on the phone as possible. We call it a happy path and a sad path when a patient hits a kiosk. And we really wanted to make sure that when they hit the kiosk that they've completed as much as they could at home before they arrived, that the staff gathered as much information as possible before they arrived. And when they hit that physician's office or hospital department that we set these up in, there's a minimal workflow, and it's easy enough for all patients to use and get through it. And part of the workflow, what we've been training on is after the patient checks in, we're trying to avoid that contact at the front desk, and this way the medical staff can take the patient right in and really speed up the process of treatment for all of our patients, and get them in and out in a timely manner.
Yeah,
So,
can I just
go
jump
ahead,
in there, Laura?
Mike.
I
I was
I
just
like,
about to ask you.
well, I really like what Patrick said there, and it really spans across self-service in general, looking at a patient experience or a customer experience all the way from their home, from their interaction online, or when they're calling in, all the way through to completion of the service. The kiosk is one piece of that. But I think if you take a more holistic view to the entire experience, you can implement these types of solutions in a way that really addresses the need for the patient experience. So definitely think that that's spot on, Patrick, in terms of how you went about implementing the kiosk in the overall experience, not just just a singular device.
Yeah, and we did our best to really streamline the workflow, and it's not going to accommodate every single person. Some people just really want that, contact with the front desk staff and that interaction. And that is available for them too. The kiosk isn't fully replacing our staff. Our staff just are there and can accommodate as the patients come in. And if the kiosks get backed up, the front desk staff are also taking patients, and it gives them the opportunity. Like if you're looking at that center reach picture, 6 patients at a kiosk, 3 more at the desk, and now you got 9 patients being seen and taken care of at the same time, rather than somebody standing in line and the line backing up out the door.
So actually, that's one of the questions that came in, and I don't know if you have these numbers, and Mike, you may have them just more generally, but the average time that it takes each person to like sort of get through the kiosk registration process versus maybe the countertop process. I know that it affects wait times because now you have more people helping you have more options for getting checked in. So I'm just wondering, from a wait time perspective or a processing time perspective, do we have any idea of is it about the same? Is it a little longer for one versus the other, et cetera?
Well, so if you have a patient that completed their, got good scheduling, completed their e-check-in, signed their documents through MyChart online, and then presented to the kiosk, they're going to have a way shortened workflow, which is, we've seen patients check in under 10 minutes, under 2 minutes, when they've completed all those steps. Under 2 minutes is I think that's awesome. And again, now if you have a physician's office that's not compliant, really not gathering the information they need during scheduling, a patient that maybe didn't sign up for MyChart and complete their e-check-in, those patients can be at the kiosk for 13 minutes, 14 minutes, depending on.
And I think that answers a question that Scott had asked about how much data entry is actually done on the kiosk. So it sounds like it could be hardly any data entry being done on the kiosk, or it could be you waited and now you have to do an awful lot of data entry on the kiosk. Is that accurate?
Yeah, and that's where we see some of the practices trying to use the tablets, where they know a patient didn't complete their e-check-in. They're going to hand the patient a tablet, and they're going to go sit down because they didn't do the happy path. And
Is that what you call it? The happy path?
Follow all the instructions, yeah. So.
That's great.
Yeah, I can speak a little bit just like more holistically. I mean, Patrick, I think you do a good job of articulating all of the different scenarios and why wait times fluctuate based on what people are doing before they get there, et cetera. But across the board, we're seeing approximately a 60% reduction in transaction time or wait time when through the kiosk.
Yeah. You're our infusion department, and then we have a Mercy Medical Center clinic, and they're, those patients are going to the kiosk, sitting down, no front desk interaction. The medical staff are coming up front after they see the patients arrive on their provider schedule. They take the patient right in, and it's definitely speeding up the process.
And are patients able to schedule walk-in appointments? That was a question that was asked. Just kind of curious as to if that's a capability of the Welcome app in general.
Yeah, so we the walk-in is available. We're actually testing that for our labs, but we haven't implemented a walk-in workflow yet. We're still just making sure that we have everything fine-tuned.
Great. And are there significant HIPAA differences with the way that you worry about HIPAA because of kiosk versus personal check-in? I'm assuming not, but is there any concern or difference that you have to sort of take into accommodation or consideration?
Yeah, well, when we're doing our walkthroughs, we're really, trying to make sure that our kiosk placement is in areas where patients still have privacy. There are privacy screens available for certain doctors' offices where it's tight.
Excellent. And Mike, I know that you have some great information about, if you don't mind, pivoting a little bit to the accessibility piece, just knowing what you've learned about accessibility and the needs of a healthcare kiosk. I can pull up that slide if it's helpful.
I think just for kiosk in general, accessibility is something that has become, I would say, more prevalent within the solution itself, and having the resources at our fingertips through TPGi and Vispero to be able to identify what is needed to support people with disabilities and how to implement those within a self-service environment so that they can use this device. So we've really tapped into the industry knowledge and resources that we have with the people on this group to take that and implement it into our solutions. So we talked about it a little bit before, with the navigation pad, customers being able to plug into that, have the screen reader, talk back to them and walk them through the application as what is, kind of one area. Reach, height is another one, just overall kiosk design and the way that is incorporated, making sure the base isn't too big so somebody in a wheelchair can access the device. All of those are areas that need to be examined when we're implementing kiosks.
Great. And Patrick, were there any particular how successful has this project been, and how do you feel about it as you roll it out across more locations and so many more kiosks?
Oh, it's been great. Everybody keeps requesting them, and so a lot of the practices that we put them in, they're looking to expand and add some. But yeah, overall, it's been a great success. The requests keep coming in, like I said, and the tablets kind of got pushed off and thrown in closets. So,
which makes sense, right? They're smaller, they're more mobile. These are a little more robust, sturdier. So if checking in is one of the tasks that a patient can accomplish at a kiosk, what are some of the other tasks that, and I may have missed some of that, but are there other tasks that are there billing, or what other tasks do you see? Scheduling?
Yeah, so our workflow in the kiosk consists of demographics. We have questionnaires, we have documents being signed, payment collection, we verify guarantor information, verify primary care doctors. Patients can complete their MSPQ if they need to, which is a little tough, but we do try to capture that on scheduling more so. And it's scanning and driver's licenses and insurance card, insurance verification, contact information. We got a good workflow, and all those steps are available through MyChart eCheck-in also. So if the patients do sign in and they verify all their information, there are verification checks that we have in place to suppress certain things on the kiosks, which makes for a smoother workflow.
Great. So if I'm going to take this a little bit and just say, so if someone were a a blind user, for instance, and they were using the kiosk, very much like the sighted user who would probably want to fill out a lot of that information at home at their computer or on their phone in advance, so that it was a faster, smoother check-in process. It would minimize the amount of time that someone would have to stand or approach the kiosk and be at the kiosk and filling information out, making it more, I would imagine, accessible, because they have the ability to use their own assistive technology instead of using the assistive technology that is provided on the kiosk. And particularly because there's not a QWERTY keyboard, a full keyboard, it's just the input device. I would guess that it's a little bit faster to enter that information in advance, even though you could do it on the kiosk using the Storm audio nav input device. You wouldn't necessarily want to, particularly for massive amounts of information. And so are there other considerations, sort of that whole, I talk about it all the time when we talk about kiosks, the whole and approach, like making sure that if you can enter information on a mobile app or on a website and use a kiosk for check-in, that kind of thing is I think the best way to make sure that people are able to use the technology the way they want. And I think that makes it more accessible, because people can use it in a way that's definitely sort of the best way for them, the best method for them. So I guess that's not really a question so much as, have you found that there's different groups of people that are more likely to use the kiosk versus their phones, or, you know, that would approach a desk? Have you identified different constituents who are kiosk users, for
Yeah,
instance?
it's funny because you hear sometimes you got to worry about the elderly population, but we do have I've had 90-year-olds check in at the kiosk and love it, and so we get it's very wide ranged with
Great.
who's using the kiosk. And then you have some people that, like I said, that just want to have that interaction with a person, and they get worried. Well, we've had people get worried that the staff are going to be replaced because the kiosks are there, so they refuse to use the kiosk. But otherwise, all ages, not really meant for one person.
And do you, for your deployment plans for 2024, what does that look like in terms of what do you go through to add more kiosks? It sounds like you get the request from the different facility, and then you have to sort of start from there. Is that accurate? And what else?
Yeah, we have a list of existing departments and hospital departments that are scheduled out through 2024. As we take on new practices, they're called waterfall departments, and we're incorporating those also into the implementation plan. And it just keeps growing. Everybody loves the technology, and you see it more and more wherever you go. Those kiosks are available: airports, fast food restaurants, healthcare. The kiosks are everywhere.
And I would just jump in a little bit just with where you were going there, Laura, with kind of that omni-channel, website, mobile app, kiosk, desk, all of the different touch points. And from the kiosk side, we get asked all the time, why not just use your phone, or why not, a different method here? And for us, it's just that it's complementary. It provides, these devices to meet patients and customers where they want to be met. It doesn't, there's not typically a one size fits all technology within these spaces. And so we're seeing patients and customers, even in other channels, like Patrick's mentioning, these other industries that we're in, leverage different technologies at different points through their entire journey. So the kiosk it's complementary to the overall experience, and it's not going to necessarily replace different methods of checking in and taking copays and all of the other various things that the kiosk is doing today. So that's how we view it, and we try to build and design our solutions to support that methodology.
Yeah, and when I'm out in the field and I'm doing a support and I'm training staff, I'm presenting it that way. You have 4 kiosks here. 4 patients are going to hit the kiosk. you got 7 patients coming in at the same time. Those 3 other patients are going to hit the desk, and now you're doing things twice as fast. If you have some downtime, you're able to do other tasks. You know, improve the scheduling, collect information, make sure everything's authorized, answer the phones, which you know can be a nightmare when those phone calls are coming into all the practices and departments that we work with. You know.
That's great. And there are a couple more questions in here that I'm going to ask if that's okay. Have you uncovered any design patterns that you consider to be anti-patterns for a kiosk experience? For example, scrolling through a lengthy consent form or longer page has shown some resistance during our initial testing working on a similar application. And I'm going to actually sort of take a step back from that question and give you all time to think about it. But my comment on that is when you have these lengthy consent forms and terms, there are very few people who don't need assistive technology who read them, right? Most people just scroll all the way through to the end and hit agree and then continue. And so whenever somebody asks about that from an accessibility standpoint, we comment that, like, at least with JAWS, you can skip over the content. You know that you can listen to it if you want to, but you can also just skip over it because that's what you would do if you were cited in most cases. And so I don't know if that actually answers Garrett's question, but I just wanted to comment that very much like a sighted person doesn't read the terms and conditions that would take 10-20 minutes to read. Someone who's blind is similarly not going to read through the entire terms and conditions on most of these consent forms and things like that. I don't know, Mike and Patrick, if you guys have any comments on that.
Yeah, you know, every document has its own, you know, regulations. On the kiosk, on the physician side, we collect like HIE, HIPAA, financial agreement form, and we really tried to make sure that those forms weren't popping every single time. HIPAA is a once a lifetime. HIE, you know, gets filed based on your decision, and financial agreement we narrowed it down to like once a year. So trying to, you know, really format the documents and how they appear in the kiosk. We also, you know, have the documents available online so that if the patients, you know, follow that happy path and they go on and they do their e-check-in, they're going to have plenty of time to read those documents. They're going to complete them, and when they hit the kiosk, they're not going to populate. They're going to be, you know, filled out and filed into their encounter, and we're not going to have to worry about it. Some of the bigger departments do have a concierge assisting with the patients on the kiosk. In the event somebody has a question, there's somebody there for them. So
great. And Mike, since we have Patrick here talking about healthcare kiosks, but we also have a lot of other folks on the call who may or may not be healthcare specific. So just wondering where you're seeing out in the wild for self-service applications and kiosk deployments. Like, what are you seeing? What are the trends?
Just
3 minutes or less. No, I'm just kidding.
Holistically, just all sorts of kiosks, or specific to the scrolling question? Sorry.
Oh no, taking a step back, just kind of in general.
I mean, we're seeing self-service get implemented in a lot of different industries. I mean, healthcare is definitely a top focus for us right now. There's a lot of desire and need within healthcare facilities for a solution like this. Some of our other industries would be like hospitality. So like naturally thinking through, you know, you go to the airport and you check in at the kiosk, right? You get on the plane, and then, you know, next stop is the hotel, you know, maybe like a hotel check-in kiosk. We're seeing a lot of interest in that space. We're seeing a lot of interest in retail. Is continued to be a vertical that we focus on for self-checkout, you know, for, you know, we have retail returns kiosks, things of this nature. So generally speaking, self-service continues to grow, and new applications keep popping up for usage and kind of what, you know, like I said, meet the customers where they want to be met, right? So looking at the digital experience and seeing how that can get incorporated into the overall end-to-end journey for customers.
So I know Mike has a case study, an alternate case study that's sort of, some of the slides have been included, not the full case study, but just some of the points that we talked about here, about this healthcare kiosk and others. And just wanted to kind of point you into the deck, if you did receive the deck, to some slides that Mike has added about healthcare kiosk solutions, including wayfinding, patient check-in, and patient services, looking at the I was looking at them, and I think Patrick touched on almost everything when he was going through the healthcare industry challenges. But that included, Patrick, I think you mentioned it really quickly, and I think it's a really valid point that Mike has said, I've heard him say before, about data entry and eliminating human error from when someone is actually entering your information for you versus when you enter your own information. So some of the things that we had talked about previously are mentioned all in that deck. I'm not sharing the deck now, mainly because it just was pretty information heavy, and we wanted to make sure that this was more conversational. But if you did receive the deck, or if you need the deck, I'm actually going to flash up our email addresses that you can reach out to us. If I can figure out which slide that's on, there it is. And we can make sure to answer any questions that you have. But if you didn't get the deck, email us, let us know, and that way you can get that information that Mike has put into this deck really well for us. And just give me 1 second, I'll share my screen again with that. There we go. With the contact information, I'm including Tracy Murray's contact information on this slide. If you have any questions about kiosks and accessible kiosks, accessibility and kiosks, or any just general questions about this presentation, you can email tmurray@vispero.com, and that's TMURRAY@vispero.com. And if you have questions, particularly for Mike, is that the right? Did I get that email address correct on yours?
Yeah, that's right. My first name's Nelson. I go by Mike.
I had to triple check it. I thought I was being really stupid.
Yeah.
So it's N as in Nelson, Raudenbush, RAUDENBUSH @kiosk.com. And that's any questions that you have about kiosks. If you have questions about this particular project, we are going to filter them through so that Patrick doesn't get inundated with questions about something he's not selling. And as much as Patrick is the guy on the ground that knows everything about his deployment, and so he's the one that y'all want to talk to. So that's why there's this like layer that we have to filter. In any case, but Mike has some really great points about wait time and about administrative efficiency, accuracy, fraud, and they're all mentioned in that deck. And we're happy to help work with you all on the accessibility piece, and applications and things like that as well. So any other questions, or let's see if I can get back to them. There we are. I have the QA slide up so that anyone can see it, if you're able to. And then that is a closer up image of the check-in kiosk that has the that's a scanner, I believe, underneath the screen. There is a payment input device on this one and a audio nav.
Yeah, there's actually 2 scanners there. One right underneath the monitor. That's a barcode scanner for e-check-in, and then the scanner for insurance card, driver's license is what you lay your card on. But I also do have one other stat.
Absolutely.
At the end of our workflow, we created a custom survey, and it only populates one time for each individual patient. And what we're surveying is, what the patients, whether they like the kiosk workflow or whether they really disliked it. And we receive a 90% positive feedback on any patient, on most of our patients that are using the kiosk workflow. So thought that was pretty impressive.
That is impressive, particularly since not people don't typically agree 90% on anything, right? So it must be amazing. That 10% that said no clearly don't like anything.
Yeah, no, it's pretty good.
Anything else that you wanted me to ask that I didn't ask, or to the audience that are still hanging on here? Any other questions that you all have for the panelists? And Mike, anything that you wanted to add?
No, I just really appreciate, Patrick, your time and insights. I even learned some from this conversation today. So really appreciate it. Nice job.
Yeah, thanks guys for having me. I appreciate it. Good experience.
We really appreciate having you. And Mike or Patrick, now you'll get to hear Mike spout off whatever it was that he just learned from you in his next presentation as this fun fact that he learned.
I'm gonna have to watch. Make sure you send me the link.
I'm gonna walk around telling everybody about that 90%, Patrick. You better believe it.
We're gonna be hearing about it. Well, thank you all for joining us. And again, if you have any questions for us that you want to ask offline, you can send us to those email addresses mentioned. And actually, I can see if I can add it into the chat before we head out. I'll at least put Tracy's in there. If you have any questions, you can email her, and mine is in there as well in the public chat. So there you go. Thank you all for joining us. We really appreciate you, and hopefully this gives you back 10 minutes of your day.
Thank you.
Thanks all.
Thanks, Laura. Appreciate it.
Thanks, Mike.
Patrick.
Yeah, my pleasure.